Hi, everyone. Welcome to our online virtual Experience VCC event. We're really excited to have you join us today. I'll start off by just introducing myself. My name is Mike. I'm the moderator for today's session. I'm also a VCC staff member. I just wanted to start off by just letting you know that the meeting is going to be recorded. So if you wish to access the video at another time, then we'll make the videos available on our website at vcc.ca/experience. If you are deaf or hard of hearing and need a sign language interpreter, please let us know in the chat. You should see an option for a chat window. Just let us know and we'll see if we can find an interpreter for you. I do want to start off by first making an acknowledgement. I would like to acknowledge that we are on the traditional and unceded territory of the Coast Salish peoples, the traditional territories of the Squamish, Musqueam, and Tsleil-Waututh First Nations. Now, this session is an opportunity for you to learn more about our nursing program. On today's agenda, we have a number of program representatives who will talk about the program for about 2 to 3 minutes. We also have an advisor available should you have any general questions. And we'll then follow that up with a question and answer period. If you do have any questions, then please submit them in the Q&A. Okay, can I ask the program representatives and the advisors to quickly introduce yourselves? So if you could tell us your name and your role with the college, that would be great. So maybe I'll start off with Janita.
Hi, everyone. I'm the department head. My name is Janita Shappert, and I'm the department head for the practical nursing and the access to practical nursing program here at VCC.
Perfect. Dee?
Hi, everyone. My name is Dee Duncan, and I'm the department head for the Bachelor of Science of Nursing program, first year entry, and the advanced entry, which is our entry for LPN to BSN students.
Great, thanks, Dee. Domingo?
Hi, good afternoon, everyone. My name is Domingo Salviejo, and I'm one of the 6 academic advisors at Vancouver Community College. Welcome to Experience VCC.
Awesome. Thanks, Domingo. And Tony? Tony, you're on mute.
Oops, sorry. Welcome, everyone. My name is Tony Gladstone. I'm the Indigenous Engagement Advisor at VCC, and I work with Indigenous applicants for programs and courses at the college.
Okay, great. I'll just switch it over to me now. Okay, why don't we get started with the presentation mode. As I mentioned, that we do have a Q&A feature in MS Teams, so if you do have a question, do feel free to submit them through the Q&A icon. And just so everyone knows, there's actually a 10 to 20 second delay. So when I'm speaking, it'll likely take about 10 to 20 seconds for you to receive it. So if there are awkward moments of silence, and that's likely the reason why. Okay, why don't I hand this over to Janita, and she can talk about access to practical nursing and practical nursing.
Great. So I just want to mention, as far as I'll talk about our practical nursing program first, which is considered our generic program. We have 2 intakes a year, and we start off in January as well as a September intake. We usually fill to about 48 students, and the program for the generic runs for 16 months long, and it runs through the summer. And usually the only type of break that there is just during the last 2 weeks of December. Otherwise, we run straight through. The generic program is comprised of 4 levels of the program, starting with level 1 to 4, and each one, because we have a spiral curriculum, increases in complexity. Level 1 starting with the older client, and level 3 is with the specialty clients, maternity, pediatrics, and mental health, and ending with level 4 with acute care. We end the program with 6 weeks of preceptorship, where you are working alongside a nurse in the healthcare setting. So that is our generic program. Our Access to Practical Nursing program, we have 1 intake a year, and it is 13 months long, because we give you 3 months of credit for your previous healthcare assistance certificate or experience in working as a nurse in another country, perhaps. Again, the Access program, 13 months long, so it actually is levels 1 and 2 combined together, and then moving towards level 4 in the end. So as far as the Access program, we are still accepting applications. We did have to change due to COVID our start time. Our September cohort was delayed until February 8th of next year. So if you are wanting a seat in that program, please feel free to send in your applications now. As far as our PN program, I just want to put a plug in saying that, 90% of our VCC PN graduates get hired at least on a casual basis, if not on a full-time basis. So we do have a very high success rate. And we work very closely with advising so that advising can help you meet your entrance requirements into the program. So advising is another great avenue to reach out to if you are thinking of applying, but are perhaps missing some of the requirements. So that's my 2 programs.
Great, thanks, Janita. A question has come in from
Sure.
Lana. Am I in the right webinar? I'm looking for taking Health Unit Coordinator. Is that something that you'll cover?
No. No, my program, I just run the practical nursing. So the Health Unit Coordinator is a separate program, but it is offered through VCC.
I can jump in there. I'll just, I'll put a link to register for that session, which is tomorrow. I'll put that in the chat.
Okay, perfect. Thanks, Danielle. Okay, sorry about that, Lana. Okay, why don't I switch it over now to Dee. I'll just switch the slide. Now over to you, Dee.
Okay, great. So in the BSN program, we actually have 2 streams. We have a 3-year stream, which is for students who have no prior healthcare experience and met our prerequisites. It is a 3-year full-time program. We do provide a break after each term, and the terms are typically 3 months long, a little bit between 3 to 3.5 months long. We start off with term 1, which is very much our foundational term, and every single term that we have in the BSN program has a clinical component. So you always are at school for 3 days a week, and then you're in a clinical setting 2 days a week. And in term 1, we tend to go to more of the subacute rehab units. Term 2, again, is more gerontological focused, and then followed by what we call a consolidated practice experience of a 3-day-a-week full-time practice experience where the students are out in clinical and you do not come into the college during that period of time. Term 3 is our first acute medical surgical rotation. and it's followed by a term 4, which is a pediatric maternity. And then term 5 is our mental health. Term 6 is our higher level complex care med surge rotation, and then that's followed by public and population health in term 7. And then finally, term 8 is your final preceptorship, and that is a 3-month full-time experience where you are out with a experienced RN in practice, and you are followed closely by a faculty advisor. So that is our 3-year program. And then we also have an advanced entry program, and this is for people who have been licensed practical nurses and want to become an RN. So they come into what we call the bridging term. And this program is 2 years long. So typically that starts in our first year program starts in September, and the advanced entry starts in August. And it again, you start with the bridging term, and then we bridge you into term 5. So again, term 5 is the mental health, followed by complex acute care. And then term 7 again, population public health. So you just follow into the same streams as the first year program with term 5, 6, 7, and 8. And then you're completed that program. So, and after you complete our program, students are required to sit the national exam, which is the NCLEX for RNs. And that once that exam is passed, you are eligible to apply for registration as a registered nurse with the British Columbia College of Nursing and Midwives. And so that's it, I think.
Okay, great. Thanks, Dee. We've got a lot of questions here, so we'll get to them in a bit. I'm just gonna turn it over to now. Oops, sorry about that. To Domingo. Let me switch it over. So if you could talk a little bit about advising services.
Thank you, Michael. As I was saying, so I'm one of the 6 advisors at Vancouver Community College. So if you want to apply to any of the programs, BSN, Year 1, Advanced Entry, LPN, or Access to LPN, we assist you in applying and meeting the prerequisites. And if you do require assessments, we also provide you with assistance as well. I know a lot of people. I'm pretty sure you have tons of questions about how to apply to these programs, and I always recommend that you speak to one of us academic advisors so we can guide you and provide you with accurate programs and information, because I know these programs are sought after programs at Vancouver Community College, and we'll be delighted to assist you. So if you do want to contact us, I'm pretty sure Michael or one of our marketing officers will provide you our contact information, but I can provide you with the phone number just in case. It's 604-871-7000 and press 2. So just so you know, if you're gonna be booking an appointment to speak to one of us, either by phone or Zoom, by phone, we're actually gonna be using our private cell phones. So expect that when we call you, it's gonna come from a private number. Just make sure that you do not ignore that call, because waiting time to speak to us takes about, I believe, 2 weeks, I think, maximum, just to book an appointment. So make sure that just in case if you want to book an appointment to speak to us by phone, pick up the phone if you see it's a private number, because I'm pretty sure it's from one of us. Thank you.
Domingo, can you also clarify, do you also offer Zoom?
Yes.
Advising? Okay.
Yes.
We
offer Zoom advising appointment, and quite recently we have also offered drop-in, which is 15 minutes, also by phone or Zoom.
Okay, perfect. So if you are interested in contacting advising, which I do recommend and which Domingo strongly recommends, just visit our website. I've put it in the chat, vcc.ca/advising.
Mhm.
Okay, great. Thanks, Domingo. I'm gonna hand things over to Tony now. Tony, who can, oops, oh, there she is. Okay, who can speak about Indigenous services offered at VCC.
Wonderful. Thank you. Thank you, Michael. I also provide academic advising, but specific to Indigenous peoples. That means First Nations, Métis, and Inuit. I am open to having phone conversations, email, or Zoom if you're interested in any of the health career programs talked about today. We have an Aboriginal enrollment policy at the college if you are of Indigenous ancestry and are interested in learning more about the requirements for these programs. Send us an email to indigenous@vcc.ca, or you can call the general number and select option 5.
Perfect. Thank you, Tony. I also included the link in the chat and the Q&A section as well.
Wonderful. Thank you, Michael.
Okay. Why don't we jump right into the Q&A? There's a lot of questions coming in now, so I want to give everyone an opportunity to ask away, because that's the whole point of today's session. So let me just switch things over. So there's a question here. I'll publish it and make it public. Can you give us more information on LPN exam?
As far as the exam right now, we are switching over to a new exam vendor, and that is going to be done. The new exam is going to be called the Rex PN, and it is going to be offered as of January 2022. So we are preparing our students to write that exam, as those questions on the exam will be using computer adaptive testing. So the VCC program in itself really prepares the students to write the regulatory body exam. So right now, the Nursing Council of Nurses and Midwives, we are still going through the old exam, which again, after you graduate from our program, there is certain windows that allow you an opportunity for some testing dates. As you know, with the new exam, the testing dates will be a lot more flexible and will be spread out throughout the year and will be available sort of throughout the Lower Mainland and even throughout Canada, really. So that's sort of the different initiatives. Does that answer your question?
Great, thanks, Janita. If you do have another question, it was from Anonymous, then do let us know. Oh, someone's asking, can you please say that number again or post it? I'm not sure if that was for Tony or Domingo. The number should be on the advising website. If you go to vcc.ca/advising, you should be able to see all that contact information there. And I posted it earlier in the Q&A.
I can also say it again. 604 871 7000.
Let me type that in. 604
871
871
7000 and press 2.
Okay, we got a lot more questions here. So question from Veronica. Do I need to meet all the admission requirements prior to applying? I would like to apply for February 2022, and I wonder if I can work through meeting the requirements during that period. So I'll go ahead and publish that.
Sure. Do you want me to answer?
Oh, sure. Anyone who's able to.
Okay. Oh yeah. Please do apply to the program. Just so you know. However, seat offering to the program is first come, first qualified. So I always say to students, sometimes meeting me either in person or by phone, I always say, please apply to the program for the LPN and access to LPN. And you can just submit all the requirements as you go, because again, but seat offering again to the program is first come, first qualified. And just so you know, for the BSN year 1 and the advanced entry, we are currently not accepting application to the program. However, I'm pretty sure you can discuss that later as we go through this session. But I always say keep checking the website for application updates. However, if you don't have all the prerequisites, or you're still completing the prerequisites for the RN, either year 1, advanced entry, continue taking those prerequisites and complete.
Hello, Michael.
Yes.
I would like to add that the Aboriginal enrollment policy that we have at the college, if there are any Indigenous applicants who are attending this session and are interested in applying for those programs, please send us an email to indigenous@vcc.ca, and we will respond to your inquiry and start you on with your application process for any of the programs that were shared today.
Okay, perfect. Thank you, Tony. Just to confirm, indigenous@vcc.ca?
Yes,
Okay.
or they could call the general number and select number 5.
I'll put that in the chat.
Thank you, Michael.
Oh, you're welcome. Okay, a lot more questions here. I have a question from Anonymous. Where can I find prerequisites for nursing? So I think I can answer that because I've got the link copied. So I'll just paste the link here. Okay, another question from Anonymous. Like when we finish the program, we can take the exam right away and get licenses, meaning after we get the license, we can work as an LPN. So I'll go ahead and publish that. Can someone answer that?
Yeah, sure, I can answer that. Yes, so as I said, after you finish your program, you finish your preceptorship, which is the last 180 hours that you need to complete. Once you complete that, you get a letter of completion from VCC stating that you have met the learning outcomes of our program. And then what you do is you get your credentials and your transcript through VCC, and then you start applying for a seat to write the exam. And again, the exam windows are usually around the end of the year and sort of the mid of the year, okay? So, and they vary. So depending on that exam window, you can go ahead to write. If you are waiting to write the exam, you can email me as a department head and ask for a competency letter in which you could work as a care aide in the meantime.
Okay, perfect. I hope that answered your question. We do have a question from Veronica, but I'm afraid I'm not sure which part she's referring to. Veronica was just asking whether or not it was what someone was talking about was for access to practical nursing. Sorry, Veronica, we didn't get to your question, but if you could phrase that again, specifically what you're looking for, then we'll do our best to answer that. Another question from Anonymous. What will be the schedule for that access program in February 21? So I'll go ahead and publish that.
Okay, so the February class, it will run the first term, will run all the way from February 8th of a start date and will end the term with a 4-week practicum, a hospital experience, and it ends June 18th. So that would be the first term. Then starting June 28th, you'll start your 9 weeks plus a 3-week clinical experience with level 3, ending September 17th. You get 1 week off, and September 27th, you'll enter into the final term of the Access program. That will end on December 10th. And then you will have a break for Christmas and come back in the following year to complete an 8-week clinical experience, and so forth. It'll go on with another 6-week preceptorship. So we're probably thinking of you finishing around sometime in late April.
Great, thanks, Janita. I hope that answered your question. Another question here from Angela. Hello, what do the actual courses look like in the LPN? Are they mainly all sciences?
Well, the courses vary. So some of the courses that we have each term are all going to be the same, except with levels 1 and 2, we have pharmacology. So we have Pharm 1 and we have Pharm 2. Okay, in Access, it's Pharm Access, which is a combination of both. Now, the rest of the courses comprise of health promotion, and we have a variations in health, which is focusing more on the disease process and health conditions. Okay, we have professional practice and professional communication. So those are our courses that we carry on throughout each term, but of course, each level that you go into, each of these courses increase in complexity.
Great, thanks, Janita. Another question from Anonymous. Are you still accepting applications for LPN January?
No, actually, Domingo, do you have anything to add to that, if you know numbers?
Yeah, I always say apply to the program, because when you apply to the program, it's letting you apply to an actual intake. But you're going to think that seat offering anyways is first come, first qualified. So apply to the program, send in your transcripts or your documents at ro@vcc.ca. And then just wait for your acceptance letter. That is, if you have all the requirements. But let me rephrase the question. What if I don't have any of the requirements? Can I still apply? And the answer is, please do apply to the program. And then just submit all those requirements as you go. Again, I'm repeating myself. The seat offering is first come, first qualified. It's not first come, first served. And since we have very limited number of seats per intake, that's why we always say, just wait for your acceptance letter. So if you're looking to apply, for instance, if you say, oh, I want to apply for September 2021, but that intake is already full, what happens to your application? It goes to the next, right? So again, what if somebody, for example, all of a sudden ignore the acceptance letter? What will happen to that seat? So that seat may be offered to you. And this is the reason why I want you to apply to the program and just complete all the requirements and just wait for that acceptance letter. Does that make sense?
Okay, thanks, Domingo. Someone was asking again about the number for advising. So I'm just going to post that again.
Yeah.
And I'll post the website as well. All that information should be on our website. Okay, A lot more questions. Someone, looks like it's sort of been published, but someone has the question about, do you have RN course? D, is that yours? D,
you're on mute.
Sorry.
No worries.
Yeah, the BSN program leads to registered nursing practice.
Okay. Okay, perfect. Another question here. I have HCA designation, but have no not worked in the field. Will this still have preference in the access path?
Unfortunately, I mean, you can see if there's any courses in there that could receive some transfer credit, but we do require 600 hours of relevant work experience and recent work experience as an HCA. Just because just having the certification is not enough. You have to actually be working in the field, and that's only going to help you with the program because it's already going to be condensed from 16 months to 13 months.
Okay, perfect. I hope that answered your question.
Mm-hmm.
Another question here. Where can I find the waiver for the application fee? Okay, I'll include the code at the end of the presentation. So hang tight. Please note that the application waiver is only available to domestic students. Let's see here. Question from Anonymous. When is the program Advanced Entry BSN will open? How long / far is the wait? And is there expiration for all prerequisites taken? So I'll go ahead and publish that. So is that the question for you, Dee?
Yeah, I thought I responded to that in the chat. However,
okay.
I don't know. I actually don't really know what I'm doing in the chat. So I thought I did respond to that. I thought I published it. So basically, we are going to be, the BSN first year entry program will be open for admissions. We are going to start in likely January of 2021, taking admissions. We are looking at going to a selection-based process for admissions, and that will be using a score of GPA, and we are looking at trialing a product called Casper, the Casper test. The Casper test is a test that is used widely throughout Canada as a pre-health science selection process. So it measures traits like, well, it measures communication, collaboration, it measures ethics, professionalism, resilience. The test is taken online. There is a $40 fee for the test, and we are looking at trialing it for the 2021 September intake of the 3-year program. So once again, that's Casper, as in it's capital C-A-S-P and then small e-r. And there is no studying required for the test. You can't really study for it, but there is some trial tests that you can take online before you actually sit your test.
Okay, great. Thank you, Dee. Hope that answered. Yep, go ahead, Domingo.
Answer about the expiration, because I think I heard the question about expiration. For the BSN Advanced Entry, there's no expiration for the anatomy and physiology because you're already a practicing LPN. Okay, so no expiration for the ANP. As well, there's no expiration for the humanities and for the English. Now, if you're applying for the year 1, BSN year 1, and there is expiration for the anatomy and physiology, has to be within the last 5 years. Okay, but the English and the humanities, there's no expiration. But if you are already waiting, right? I mean, you already applied in the BSN year 1 and just waiting for your acceptance letter, they will no longer expire because you're just waiting for the acceptance letter. Okay.
Okay, great. Thanks, Domingo.
Mhm.
A question from Anonymous. How about pediatric, sorry, I can never pronounce this.
Pediatric nurse.
Thank you.
Pediatric
Nurses. I'll go ahead and publish it. I think this is a two-part question. And where can I find that info?
Well, I mean, to be a pediatric specialty nurse, you do need to have a Bachelor of Science in Nursing. So on saying that, and there are some licensed practical nurses who work in pediatric settings, you know, such as community home support settings. There is actually quite a big role for LPNs in community home support with pediatric patients. So, but if you wanted to work in kind of more of a neonatal intensive unit or on a kind of a higher acuity pediatric unit, you need to have a Bachelor of Science in Nursing, which leads to an RN. And then you can apply for positions in pediatrics. There is also a post-RN course at BCIT in pediatric specialty nursing, and many of the health authorities will sponsor, you know, existing nurses to go and take those courses once you are working for them.
I was going to add as well, in the practical nursing program, our level 3, that's one, pediatrics is one of the specialty topics. So when you do become licensed as a practical nurse, an LPN, you could go back to school for a short course through our continuing studies here at VCC and perhaps take an immunization course. And that, along with your LPN designation, would qualify you in public health, providing immunizations and public health visits and so forth. So as Dee was mentioning, there is quite a large role for LPNs in PEDS.
Okay, thank you, Dee and Janita. Another question here. Can my daughter start the application even if she is still finishing her grade 12? So I'll get ahead and publish that.
Yes, please do apply to the program. And then once your daughter completes her grade 12, then all she has to do is submit her transcript to ro@vcc.ca. Now, again, if your daughter wants to apply to the LPN, we have specific requirements, obviously, and these are English 12 with a B, Biology 12 with a C, and Math 11 with a C. If your daughter wants to apply for the BSN Year 1, please note that your daughter will be required to take university transfer courses, and the high school prerequisites that we're going to look at in her transcripts are Biology 11, C+, Biology 12, C+, Chemistry 11, C+, Pre-Calculus 11, C+. There you go. And English 12 with 72% or better. There you go.
Thanks, Domingo.
Yeah.
Oh no, okay, we got a question here. I think I applied to the wrong VCC, Vancouver Career College.
It's not us, unfortunately.
Yeah, I just our official website for Vancouver Community College is www.vcc.ca. I'll just include that. Okay. I think this is in follow-up to the question about her daughter.
Yeah.
Does she need to take the IELTS even if she finished her grade 12 here?
No. The IELTS is only for those who are ESL or those who have no English 10, 11, and 12. So or for those people who were educated abroad.
Okay. Another question from Anonymous. Do I have to take Nursing 1602 for the LPN program if I'm taking first year Anatomy and Physiology?
what we require is we need biology 1120 C plus and biology 1220 C plus, and that will pretty much cover nursing 1602. So if you're only taking biology 1120, you cannot use that towards nursing 1602. It has to be 2 A&P. So A&P 1 and 2, C plus, you can use that to meet the nursing 1602 B minus.
Okay, thanks, Domingo. I'm always impressed how you can pull these grades from your memory. Just a reminder to everyone who's attending, we will make this video available to the public on our website at vcc.ca/experience. So if you've missed some of those letter grades that Domingo's firing off, then you have access to this video. And again, we just encourage you to contact advising or contact a program coordinator. Okay, which program, either LPN or RN, has more opportunities to get the seat, and what's the qualification for those programs? Thank you.
That's a good question. Again, I always say apply and submit all those documents. Now, let me rephrase the question. Can I apply for both programs? Can I apply for LPN? Sure. Can I apply for BSN year 1? Well, unfortunately, we are currently not accepting application for year 1, even the BSN advanced entry. So in other words, you cannot even apply to the nursing, right? But let me rephrase. Can I apply for the LPN and health unit coordinator at the same time? Of course you can. We're not gonna stop you from applying to both programs. However, you gotta, once you get acceptance letter for both, now you will have to decide which program do I need to take, because obviously you cannot take 2 programs at the same time. The system won't even let you. You know what I mean?
Okay, thanks, Domingo.
Mm-hmm.
We've got a lot of questions, so that's great. I'm glad I'm glad you're engaged in this. Someone, I guess, was a follow-up to another question for LPN course. Sorry, we might have missed the first part. So if you could provide details about what the context is, then we'll do our best to answer that question. Another question, where can I find the waiver code for the application fee? I'll provide that at the end of the session, so hang tight. What's the student demographic, and is the coursework pretty heavy each week? If I fail the clinical practicum, do I have to repeat the whole term? That's a good question.
Is that in relation to the Bachelor of Science in Nursing program or the LPN program? Do we know?
They don't say, unfortunately.
Yeah. I can speak to the Bachelor of Science in Nursing program. Yes, the course load is quite heavy in the program, but we do, have a lot of support for students within the college for that course load. We, have quite a high success rate in our program, so it is doable, definitely. And yes, if you are unsuccessful in a clinical placement, you do have to repeat that one course again when it is offered.
Yeah, and I would concur the same with the PN program as well.
Okay, great. I hope that answered your question. Well, someone's asking about the waiver code again, so someone's really motivated. For Access Practical Nursing, where do we write the knowledge assessment examination?
Well, the knowledge test can be done through our assessments office, assessment center, but right now we're closed. And so, keep on checking the assessment center web page.
Do you have a link for that, Domingo?
You can email them assessments, that's plural, at vcc.ca.
Assessments with an S at vcc.ca.
correct.
Okay. Question here. What's the student demographic and is the coursework pretty heavy each week? Oh, I think someone already asked this, but she did add, or he added about student demographic. Does anyone want to comment about that?
Well, you know what? As far as the students that we see, you know, majority that we see are, I would say, the average age. A lot of them are adult learners. When I say adult learners, they're not some you know, like they already have prior education. But we also have have a lot of applicants who just, you know, finish high school as well. So that would be around, you know, 19, 20, 21. But the average age would be about 25, I would say.
Okay, interesting. Question about the pandemic. So when there's, I guess he or she's asking about when we're facing a pandemic situation like now, is the nursing program still open? Is it online? Thanks.
I can answer that for the practical nursing program. For both the access and the practical nursing, right now, 70% of our curriculum is put online to accommodate, as VCC campus is closed for face-to-face instruction. However, 30% of it for students are brought back to the labs, okay? So we're not bringing students back into the classrooms per se for lectures, but the labs in small group setting with the COVID health guidelines and with a safe approach, we have managed to do that. So again, the 70-30 sort of split for practical nursing.
Great, thanks, Janita. Dee, do you have anything to add in your respective area?
You're muted.
It's very similar to the BSN program as well. We're bringing, you know, most of our content right now is being delivered online. However, we do have small group labs that are being offered, you know, as a face-to-face. So they're very, you know, socially distanced labs. We have 6 students per lab with 1 instructor, and we've restricted the time on campus to just 2 hours for each lab, so we can accommodate all the students in that class.
Okay, great.
And we still are going to clinical. Yeah, we're still having students go out to the clinical settings, and the health authorities have been very supportive of our students being out there and have been providing the right PPEs for students and ensuring that there's, you know, student and patient safety.
Okay, great. Someone, this is a part of, I think, of an earlier question inquiring about VCC Health Sciences Math Assessment.
Oh, the Math for Health Science Assessment, thank you for asking that question, because there's an option for you now to take the Math for Health Science Assessment in person. However, it's very, very limited. You know, when you come to the assessment center, you need to observe proper safety. So if you want to book for the Math for Health Science Assessment, if you want to take that in person, please email assessments@vcc.ca. In addition, you also have the option to take it online. And if you do want to take it online, you need to connect with cca@vcc.ca, because they can provide you an online test. Now, let me rephrase the question. What if I take the Math for Health Science Assessment and I failed? What's my option? Your option is to take Math 1054, which is Math for Health Science, and you can take that self-paced through College Career Access, and that again is cca@vcc.ca.
Okay, let me just get that, cca@vcc.ca. .ca.
Correct.
Okay, wow, a lot of C's. Okay. Okay, question here. What is the qualification for the LPN or RN?
Well, that's a vague. What do you mean qualification? What does that mean?
Unfortunately, there's no other information.
I'll try my best to answer, because
Okay.
when you say qualification, we're gonna look whether you meet all the program requirements. For LPN, we require nursing 1602 with a B minus. We require English 12 with a B. We require Math 11 with a C, which is Pre-Calculus 11 or Foundations of Math 11 with a C. And you need to pass the Math for Health Science assessment with 72%. Then that's the qualification for the LPN. However, for the BSN, year one, you need to complete biology 1120 and biology 1220. You need to complete 6 credits of English, which is English 1100 and English 1200, and 6 credits of any humanities of the same, either psychology 1100, psychology 1200, or sociology 1100 and sociology 1200. Again, please, if you're applying for the BSN, I want you to keep on checking the website for application updates, because as you know, Dee mentioned, admission to the program is going to be competitive, and there you go. So keep on checking the website.
Okay, thanks, Domingo.
Mm-hmm.
If I want to go into a program in September 2021, when should I apply?
Again, there's no application, there's no date of application, there's no deadline of application. I always say apply to the program and then submit all the requirements, meaning submit your transcript, make sure that you have all the requirements, and then just wait for your acceptance letter, pretty much.
Okay. We may have answered this, but a question from Gabrielle. Do I have to take nursing 1602 for the LPN program if I'm taking first year anatomy and physiology? It sounds familiar, but
yeah, I think I already answered that. But if you're taking the anatomy and physiology, the university level, you need 6 credits of those in order to use it towards nursing 1602 B minus. In other words, you need to do biology 1120 and biology 1220 and use both towards nursing 1602. If you're only taking biology 1120, which is ANP1, you cannot use that towards nursing 1602. Again, we need 6 credits of the ANP. So you need ANP 1 and 2, C+ or better for both.
Okay, thanks, Domingo. I just want to be mindful of time. It's 1:53. We'll take a few more questions and then I'll just wrap up, because there are some inquiries about the codes for the fee waiver. So I'd like to share that with the group as well. So maybe we'll take a couple more questions. I'm on the wait list for January 2021. Is there a chance to get in the program?
Wait list for what? What program? Are we talking about LPN or are we talking about BSN year 1 or year 3?
It would have to be the LPN because we don't have an intake in January.
Okay, gotcha. So if that is the case thank you. Yeah, so for the LPN, so the question again, will I be offered a seat? Is that what it is?
I'm on the wait list for January 2021. Is there a chance to get into the program?
Once you're on the wait list, that all you have to do is wait for your acceptance letter. Just so you know, the acceptance letter, we send that out 3 months prior to the program starts. So if you haven't received anything, then chances are you're not going to be offered a seat. However, people with even those with the acceptance letter, they do sometimes change their minds. So what I want you to do is I want you to connect with the registrar's office by email at ro@vcc.ca and ask them if you can be put on standby list. Okay, so again, connect with ro@vcc.ca and say, I just want to be put on the standby list. So just in case if somebody with an acceptance letter says, I'm not gonna I'm not going to do it this time, that seat may be offered to you. But however, take note that you're not the only one asking for a standby list, right? There are other people who may be already on a standby list, so it's not guaranteed.
Okay, I can go. Can I go from HCA to BSN?
Good question. You can apply for the BSN, but let me rephrase the question. What will I be able to go into the advanced entry with my is that healthcare? Did you say?
I'm sorry?
Can you repeat the question
Oh,
again?
the person's inquiring whether they can go from HCA to BSN.
No, there's no advance. There's no bridge from HCA to BSN. But I'm not going to stop you from applying to the BSN. But you need to meet the prerequisites to get into the BSN. Those requirements, meeting the requirements for HCA is totally different from meeting the requirements for the BSN, because the BSN requires university level courses, whereas healthcare assistant only requires English 10 or proof of English language proficiency.
Right. And if you do have an HCA certificate and you go out to work and you start to upgrade some of those courses, you could ladder into the practical nursing program, into the access program, and then completing those 13 months. After completion of those and then providing some work experience as an LPN, then you can bridge into the BSN. Correct. That is possible. So it's sort of, we do have a very nice laddering system at VCC among our departments. Mm-hmm. So it's great.
Okay, thank you. Maybe we'll just take one more question. There's still a lot of questions. I apologize if we're not able to get to your question. If we aren't, then as mentioned before, please don't hesitate to contact advising or one of the program coordinators, and they'll be more than happy to help you. I think this is related to the question Janita, you just answered. Hello, I have a HCA certification, but no recent employment hours as an HCA, because I've been working for Life Labs as a, oh boy, phlebotomist. I butchered that.
Phlebotomist, yeah, phlebotomist, yeah.
If I were to apply, will I be considered if I were to apply for the LPN advanced entry?
I guess if you're meaning the access program, not the advanced entry. I mean, like Domingo said, you should apply, right? Again, I can't stress the importance of having work experience as a HCA, because that is why we're giving preferential treatment to you, because we know you've received 600 hours of experience. So that's why you can pretty much shave off 3 months of your program instead of 16 months. So, if you have an HCA, I would go for it and work. And, the hours really tally up quite quickly.
Okay, great. We've got 2 more minutes. So I think we'll end the Q&A portion of this session. Just want to say thanks to all the attendees who had some great questions. So again, if you got any more questions, or if your question wasn't answered in this session, please do reach out to advising, and they can help get you set up. Sounds like the common theme is go ahead and apply, and then see what happens. Okay, I'll just wrap up with a few more points. So because people have been inquiring about it, I'll talk about just services for students, and I'll go very quickly. We offer a wealth of services to students. We have advising services, financial aid, Indigenous services, disability services, counseling services, and free professional tutoring. So if you go to our website at vcc.ca, and if you click on students, you'll see all these resources and information about them. Next steps, we encourage you, if you'd like to learn more, to attend an info session. We offer them throughout the year, So keep an eye out for any programs that do offer info sessions. It's on our website at vcc.ca. There's a box labeled info session. As Domingo mentioned, please, we encourage you to meet with an advisor, set up an appointment. They do offer Zoom or by phone call. And if you're ready to join the VCC family, then you can apply at vcc.ca/apply, and we'd be thrilled to have you join us and be part of your academic path. So this came up a number of times, the application fee waiver. This is only available to domestic students, unfortunately. So if you go to vcc.ca/apply, the code is info 1020. I'll type that into the and you'll get the fee waiver of $35 value. And finally, we do have a contest, a chance to win one of 3 $1,000 tuition credits. So if you go to our website at vcc.ca/experience and type in the code first-choice, you can enter to win the tuition credit.
I don't know why. I think it needs to be changed.
And I'll type that in the chat as well.
Actually, keep it. No.
Okay,
We're almost
that's
done.
it. So thank you, everyone, and thank you, presenters. A lot of good questions, a lot of engagement here. So appreciate that you were able to answer as many questions that came in. We still had some outstanding ones, but again, hopefully you'll be able to connect with an advisor or program coordinator. Yeah, we're excited to have you join us if you're interested in applying, and we look forward to being part of your academic endeavors. Okay, thank you, everyone.
Great,
And thanks,
thanks, Michael.
Janita, Domingo, and Dee.
Bye-bye.
Thank you. Bye-bye.
Bye now.